Welcome to Safety Spectrum, your environmental health and safety connection. This program is a presentation of the Michigan Safety Conference. For almost a century, the annual conference has provided credible educational opportunities and valuable support to the safety and health practitioner by offering 120 instructional programs along with exhibits highlighting the latest in safety equipment, instrumentation, and demonstrations. To learn more about the conference, please find us at safetyconference.org. Welcome to Safety Spectrum. I'm your host, Sheila Ide. Our topic today is getting to the bottom of back health and safety. Another tool in our arsenal of managing injuries could include the services of chiropractic professionals. Today, we will discuss prevention and possible options for rehabilitation. My guest today is Dr. Charles Roost, Doctor of Chiropractic. He is a fellow of the American Association of Spinal Biomechanical Evaluators and also a certified spinal disability evaluator. He is the author of 7 books, including a text on chiropractic patient care and practice management. He is the owner and founder of Delta Chiropractor in Lansing, Michigan. So thank you for joining me today, Dr. Roost.
I'm happy to be here. Thanks for having me.
Appreciate it. So why don't you tell me a little bit about what your clinic does?
Well, we've been in practice for 43 years, and we have 3 other chiropractors. So we have a team that brings information from 3 different chiropractic schools, and we have decades and decades of experience. Most of our practice is kind of general family health, but we have had some focus on sports chiropractic, some workers' comp chiropractic, some auto accident chiropractic, but it's pretty much a general practitioner level of chiropractic.
So what does a chiropractor have to offer environmental health and safety professionals?
Yeah, it's kind of a unique question. We don't get that a lot, but from my point of view, there are 3 facets that a chiropractor can offer in relation to environmental health. The first is prevention, learning practical applications like ergonomics and things like that can help avoid injuries. The second one is treatment. If an accident happens, we can intervene after the injury has occurred. And depending on the extent of the injury, we're very effective with spinal rehab. And then the third piece is hardening for return to work, teaching exercises and other factors, reinforcing ergonomics that can make returning to the job a safer undertaking.
So how does a chiropractor contribute to job placement in a safety system?
Chiropractors really can be seen as biomechanical experts in spine health particularly, and how that relates to neurology. People think of chiropractors as back doctors. We're really nerve doctors more so, but those two interact in very intricate and you can't separate the two. They work together so much. So we're well placed to contribute to all 3 of those facets that we just talked about. And this is especially true when we start talking about this age of remote workers and the tendency to their tendency to try to cobble together a workspace at home. So chiropractors can contribute again in several ways. First of all, on-site evaluations. Chiropractors can look at a work situation, whether it's desk or a factory even, and look for biomechanical danger areas. Secondly, the idea of conceptual evaluations. So a chiropractor can contribute to an employer's understanding of ergonomics and ways that they can incorporate concepts of ergonomics into specific workplace and work stations. And then thirdly, we obviously offer education in a one-on-one encounter. Our patients are constantly being taught more about how they can get well fast and stay well longer.
Is age a contributing factor?
Well, it sure is. You know, as we age, the battles get steeper, mostly because of accumulated stress and accumulated wear and tear. And I don't like making excuses as I'm old, therefore I'm going to have this. Our goal is to help people rebuild stability so that they can keep doing the things they want to do longer and longer into their lives.
Yeah, you mentioned how ergonomics a little bit. I've been in the business for a long time, and I go back to when we first started using computers at our desks and putting the keyboard up where people, I found a ream of paper was exactly the right height to get the keyboard up high enough so you could get your wrists in a neutral position. So the ergonomics has really exploded over the years, thank goodness, looking at the job and not blaming the employee. So that's a good point. So what can an employer do to improve their employees' health and safety?
Well, most of it is a combination of listening and being willing to explore new ways. So I think it's important for employers and supervisors to listen to the person who has the boots on the ground. They're the ones that know how their body's reacting to the stresses that are going on in a specific job situation. So that practical look, that visceral understanding of what it's like to work that job is important. And then secondly, the willingness to change involves looking outside of the idea of that's the way we've always done it. You can't just live with that because the business changes, the job requirements change, people change. So you got to be willing to look outside of corporate memory and looking for things that can be done different or better. Because routine can be good. There's reasons we have routines, but it can also cause trouble too. So having a fresh eye instead of just looking at the way it's always been done is important.
Yeah, we recently did a program where we were trying to get away from we got to quit blaming the employee for getting injured, that it may be the way the job has been set up. So that ties right into what you're talking about. It's sometimes it doesn't work though. As a chiropractor, I'm sure you have your successes and some not so successful.
Yeah, because every individual is different. You can look at a statistical outlier and say, well, that doesn't fit what works for all these other people. And it's because everybody's different. Everybody's a unique person. So you really have to look at it with that in mind.
What kind of tools do you use? I noticed since I've been going to a chiropractor that, there's different tools that you utilize now,
You know,
different from the old days.
chiropractic's been known as a hands-on, low-tech chiropractic or healthcare provider. Well, that's changing pretty rapidly. I was once in a while I'll walk through my office and look at the number of computers that are in my office, and it's really stunning. Obviously, office procedures are done by computer, but also a lot of our evaluation is done with computerized technology. And even most of our adjustments are done with computerized technology yet nowadays. So the technology has advanced, and we bring kind of meld high tech and the typical we're getting pressure off nerves look at chiropractic. So it's a combination of high tech and old things that have worked for decades.
In other words, you're setting people straight, right?
There are a lot of puns that we can come up with at this moment. So yes.
So you've been in practice for 40 years, so you must have really embraced the whole computer mechanical side of this.
I did, about I don't know, 15 or 20 years ago now, I started looking at chiropractic and who it can help and who it can't. Some people, for instance, with a lot of degeneration and arthritis or osteoporosis, may not be candidates for the typical traditional adjustment with the crunching and twisting. So the technology we brought in is very precise, very low impact as far as how hard we have to push. It's precision chiropractic instead of high energy chiropractic, and it's very effective. We use that for probably 90% of our patients now.
Which kind of triggers another thought that we talked about is the chiropractors themselves using hands-on, don't they have a lot of injuries as well?
Great point. The statistics for chiropractors having to leave practice because of injuries on the job is pretty startling. I don't know what the current statistic is, but chiropractors hurt their backs, ironically. They hurt their shoulders and elbows. So this technology makes it possible to bring a really effective adjustment without beating up the chiropractor as well.
Yeah, I know we talked, you don't really do work hardening. You do some job placement or look at jobs, but I can recall some folks that I tried different modalities on them. And, I hate to get to the point of surgery, and I think you do too. I mean, it's always almost like a failure, but I've had people that we've worked with work hardening and they still go back out and do it the same way and get hurt again.
It's hard for employees to change the way they've always done it too.
Yeah.
Yeah.
Yes.
Surgery is sometimes necessary. I don't argue that, but it ought to be a very last resort. And we should try all the non-invasive ways we can first.
So what can an employee do to improve their own health and safety?
Again, there's some listening involved. Listen to what your own body says. If things hurt, there's a reason why they hurt. Pain is actually our friend to some extent because pain is an alarm that's telling us something's wrong. Pay attention here. So if there's discomfort or pain, evaluate that and find out, A, is it an activity that you just got to work through and get used to? Or is it breaking down tissue because of stress and repetitive motions? So listen to what your body's telling you. Secondly, listen to ergonomic experts. The way you've always done it may not be a healthy way to do it. So if you have to make some changes in posture or decreasing twisting or taking steps instead of just twisting in place, an outside observer can see some of those things that the worker themselves might not see. So listen to ergonomic experts. And then thirdly, listen to your physicians. It's important to invest in your health. Don't just assume that staying healthy will happen just because I've been healthy all my life. We wear breakdown if we don't listen to people who can see where we're putting excessive stress on. One of the analogies that is easy to make is comparing our bodies to a vehicle. You know, we don't wait to change our oil until the engine seizes up. We don't wait to rotate the tires until the tire blows out. We think ahead and invest in those things before they become a problem. So we teach our patients 6 components of health, 6 things we can work on to stay optimally healthy. And those are nutrition, rest, exercise, stress management. There's a spiritual component, and then spine care. And if we can work a little bit on all 6 of those areas, we can stay healthier longer.
What do you mean by spine care? Because I'm kind of curious, what are some of the signs that you're not getting enough exercise or the right type of exercise?
Yeah, each of those components have a number of pieces. I wrote a book called The Reservoir of Health that breaks down each of those 6 components into practical things you can work on. So you kind of, in your comment, your question there, you blended 2 things, spine care and exercise. And they all interact with each other. So you can't just take them apart, take your favorite one and expect to function at 100%. You have to work on all 6. So spine care includes getting your spine evaluated properly, getting under regular adjustment care from a good chiropractor, and then doing some very specific exercises to take care of that spine and rebuild stability. And the other pieces blend in as well as far as nutrition and stress management.
What kind of signs would you look for to know that things are starting to go south? Or is that just inevitable?
Um, well, a couple things you could look for. One is visible asymmetries. If you find yourself looking in a mirror and one shoulder is a lot higher than the other, or one hip is, or if you're walking and one foot toes out, those are signs of misalignments. You can look for habit asymmetries where you find yourself always carrying things on one side, for instance. Don't do that. Switch it up. And certainly repetitive aches and pains are a louder alarm that something's brewing and you need to have it looked at.
Well, that's interesting. Like I say, I've been around the planet for a while, and when we were in school, we carried our books
Yeah.
in our arm. We always carry. Now, kids they have backpacks. So is
And
that a great innovation or what?
it's a great idea, but what do they do with the backpack? They put it on one shoulder.
Ah, good point. Good
Try
point.
to carry it on both shoulders? No way. Better yet would be getting a bag with wheels on it. Oh, good luck at convincing them that.
I can just see them all trying to get on a school bus at the same time with wheeled carts. That's not going to happen. We talked a little bit about office workers. You had some other things that you were talking about, texting. How's that impacting the young people and that?
It's actually a named syndrome. Text neck is a syndrome from people with the posture of looking at their lap, working on their phone, or just reading. If you're doing that in your lap, you're destroying the curve in your neck, and it can cause a lot of strain. We develop what's called anterior head carriage. And the more you do that, the more strain it puts on the muscles in the back of the neck, the more it tractions the nerves in your neck, which include your spinal cord itself. Your spinal cord doesn't want to be tractioned. So you want to keep your head back over your shoulders. You want to keep your book or your phone up in front of your face when you're working on those things.
That's kind of hard to do unless you have someplace to set it, I suppose.
Yeah, and that helps. You can put a pillow in your lap, but it also brings about the idea of I've actually had patients who try to do that, and people think somebody's taking their picture because you got your phone up like you're taking a picture.
Ah, or they're like their tablet. A lot of people use tablets that way too, I
Yeah,
would think.
you get a
So
little
we
workout.
we've talked a lot about ergonomics. Is there any other thoughts you have about how ergonomics helps in preventing injury?
Well, sure. It's worth putting some time into and some thought into ergonomics because we spend 25% of our lives on a job. So it's really important to pay attention to biomechanics. So try to get some input from other people about ergonomics. Even if it's just a co-worker, have them look at your posture, have them look at repetitive actions. Look for ways where you can Move your feet instead of twisting. Twisting destroys low backs. Twisting is worse for your low back than lifting is. So try to avoid twisting, especially if you combine it with bending and lifting, but avoid twisting. It damages the fibers that hold the intervertebral discs together. So it contributes to disc problems, prolapsed discs, slipped discs. And then the thing we just talked about, the looking down. Try to set up your workstation so you're not having to look down all the time. Now, all these cautions, I understand you can't avoid them entirely, but being aware of them gives us an edge. So look for ways to avoid twisting and looking down. Those are probably the two biggest culprits.
It's kind of funny. There are some simple things. When I was a safety director, just looking at how they stored product or things that they had to use, and they don't put the heavy thing way up high or way too low. So just looking like in a warehouse or where how you store things just makes a big difference. Moving your feet, like you say, instead of twisting, moving your feet, which may or not be possible. But so, what can an employee expect when they visit a chiropractic office?
Well, a good chiropractor will start with a thorough consultation on history. We want to know what the background is because all those pieces give us clues as to what's going on in that person's health. Secondly, an examination, which involves typically range of motion, some easy orthopedic tests, some neurological tests. Most of the time, we will take x-rays because I want to know what's going on in there and not just guess at what's going on in there. You will have some paperwork. We love paperwork. So you'll and then once the chiropractor has the information we need to evaluate the spine and find the root cause, we will give you a care plan that's designed to do two things. One, get you out of pain as quickly as possible if you're in pain. And two, rebuild stability because we want to harden you to get back to your daily activities, the things you love to do. I don't like making a list of things you can't do anymore. I would much prefer rebuilding your spinal stability so you can do the things you want to do.
Yes, sports injuries are probably kind of insidious. People play a sport and it does force your body into unusual positions. Like you can think of basketball or baseball or anything where you're overstraining really to do it right.
Even
So,
in things like dance and gymnastics, boy, they push these kids anymore. I look at kids in their athletics that should be fun, and boy, they're being pushed to perform. It's hard on the spine.
was there something about being younger and not being fully developed? Does that have an impact on
Sure it
you?
does. You know, the growth plates aren't closed yet. They're still growing and changing. And on the plus side, they have a lot of flexibility. On the minus side, they can cause some damage to those joints and growth plates.
So why do you believe chiropractic medicine is important?
Well, at Delta Chiropractic Center, our passion is to bring better health to our community. We want our community healthy because a healthier community is safer, it's happier, it's healthier, and we can all enjoy our lives better. So we really focus on that. We are growing in our office. We have 4 doctors now, and we want to offer the very best care to as many people as we can. We want a healthy community so we can all enjoy it, be productive in it, have great health relationships. So take your health seriously. You know, protect your health, invest in it today. Don't wait until you're hurting. Over and over again, I'll see people who hurt themselves as a younger person. They're paying the penalty now, and that happens over and over again. So I'm not saying avoid fun and athletics, but make sure you're investing in your health at the same time.
So you think chiropractic medicine has its place in the workers' comp treatment world?
I do. I think the statistics bear that out. I should have come prepared with more statistics, but people who are under chiropractic care have far less surgeries than people who are not. People who are under chiropractic care get back to work and stay safer in work longer than those who don't use chiropractic care.
But it also sounds like an education process too, so they don't go back and do the same thing over again, right?
Yeah.
So do you have any final thoughts?
Well, thank you for letting me have a few minutes with your time and your audience. I appreciate that. We're interested in, like I said, a healthy community. So sharing some tips about twisting and looking down and health and wellness. After 43 years, I still love what I do. And that's a commentary for chiropractic care. So if there's anybody out there who does not have a career plan yet, talk to me. We'll find you a good school to go to.
We tried when years ago, one of the places I work, we tried some exercise programs before they went out and did their work. And it was effective, but they felt funny doing it. It's just funny getting past that prejudice or bias about, you can set up exercise just like an athlete. They don't just run out on the football field, throw the ball around. They work out first. They stretch. They get ready for it. So I think work people can do the same thing.
That would be an interesting challenge to get a culture together so it felt comfortable for people to do that as a group.
Exactly. So our mission with the Michigan Safety Conference is to enhance workplace health and safety by sharing EHS best practices across the spectrum, evaluating workplace injuries, embracing ergonomic friendly programs, and encouraging appropriate exercise are all ways we can help our workers. I'd like to thank Dr. Roost for sharing your expertise on the Safety Spectrum podcast. And he can be reached at delta.cairo@gmail.com. If you have any questions about this podcast, the Michigan Safety Conference, or you'd like to be a guest or sponsor one of our podcasts, you can find the information on our website at michsafetyconference.org. Thank you for listening to Safety Spectrum. This is Sheila Ide.